So Dr. Taslim, COVID-19 Innovations Deployment Accelerator, you've launched under CCAMP and you have such amazing 800 applications. Tell us about these companies.
No, absolutely. Thank you so much, Shradha, for having us here. So I think the COVID Innovations Deployment Accelerator was launched around 25th, 26th March, when we realized that we were actually in a situation where there was a large, very large scale need for innovations to help the system, but nothing was available. Right, the scale was not actually enough for us to move in. At the same time, we clearly being in the system for 8 to 10 years in terms of innovation, we realize that some of the innovations are almost there in terms of addressing that large scale need. And we thought that can we have an accelerator which can identify innovations across India which are near deployment ready, and then just give them a last mile push by connecting with government, regulatory approvals, industry, CSR funds, or any other way that anyone can help. And these are innovations which are coming from a different aspects of healthcare system. While largely in broader discussion, people talk about PPE, ventilators, diagnostics, some of the innovations are completely, coming from different angles which we are not seeing. So over the last 2 weeks, we have gotten around nearly 800 such innovations which have come. We are assessing them on a daily basis and then shortlisting and working with them to understand what is missing. First week, we have gotten around 5 top stars, which we think are very high impactful innovations which can be there. And luckily, we have gotten a lot of people to reach out to these startups through us to see how can I help them scale it up, manufacture, allow them with funding and so on. So that has been very, very helpful. And that's what we wanted. We wanted identification and assessment-based representation to the outside broad world, which is all these government agencies, non-government agencies, who can come and then say, I see now, can I help you to the next step? So today with you, we've launched next cohort, that is 13 of them, which can represent other aspects. But if you think of it, they're very, very interesting indigenous innovations which can help us. We have almost 4 or 5 in ventilator space, where right now, while we're trying to build ventilator from scratch, these guys have availability of ventilator capability for some time, and then can they address this? We have in diagnostics, we covered them in terms of what they can bring on the market. Now we have something very, very important in the healthcare setting. We have people who can do remote monitoring of vital parameters, which can help manage vitals or observe the vitals from far. Reducing the direct exposure of a healthcare professional with a patient in ICU or otherwise, and also broad systems that are there. We have now very interesting approaches which are both chemical and non-chemical based for prevention through the spread in the environment, that is air and the surface. As you heard that the secondary infections in general are deadly, but if you think of it in a hospital, how can you reduce the load of virus? And by using a technology which is as exciting of aerodynamics and textile engineering, how you can do that. So it's a very broad, the last but not necessarily the least, where you can have the cold chain issue of connecting rural and suburban patients who cannot come in this lockdown to the major path labs in the cities, how their samples can be using a cold chain capability brought to the path lab, tested quickly, and help them to not spread it further. I think these are very, very important things. And what we want to achieve is that make a case for each one of them so that the industry who not only have funding or CSR, but also have heavy engineering capabilities, who can scale them up, manufacture that, bring the resources or sourcing of the raw material, CSR funds, government, regulatory approvals bodies can actually help them out. So we are very happy that we are here. My other colleagues are here, Nandita, Niranjan, Devashini, and 10 more who are on the ground working to assess them collectively. They are all working to bring it about. And thank you to you and YourStory to be able to share with a larger community that YourStory can reach out.
If you had to give one message to everyone watching this,
a lot of this has happened because of a phenomenal surge from government to build innovation capabilities and build innovation and temperament. Because without that, we would not have this, if I may use the bench strength of innovators, which can be picked up if we have a casualty on the ground. That is very, very important. So I think the funding agencies from DBT, from BIRAC, from CSIR, from DST, from Atal Innovation Mission, they are the actually forces which build the temperament. Places like CCAM, what we aim to do is the people who are hands-on with innovations, who actually can identify, massage it, take it to the next level. And that's where now we deployed this accelerator where to identify that. And now what we are looking for is that how industry, the large industry, actually can come and take one of them saying that this is close to what I can help with. They can actually identify somebody who can scale them up. They can possibly deploy their investment into that. VCs who actually are looking to help out in a larger sense can also come and help either with the investments, loans, grants, convertibles, as you call it. It all is possible. Most importantly, idea is that there are a lot of NGOs which are working a lot, but they are restricted by the of 3 or 4 categories of PPE, ventilator, and all that. But a lot is required on the ground, the kind of innovation you saw. They can reach out to these innovators and help them out. So I think it's going to be a collective effort in terms of helping this from across the platform in terms of the industry, government, non-government, and CCOM will be very happy to seek any help from anyone, because as you did say, this is actually a complete mission that we want to dedicate ourselves to make sure that innovations which are there can be deployed and support larger society, which is in the need of that for now.